Okay, and then obviously one of the real difficulties is the number of patients who required admission to the intensive care unit. Mm-hmm. And I was interested to see the duration of stay is quite long in those who unfortunately die. And have you any algorithm or way yet to predict those on entry to ITU who are most likely to die?
Yes, we have made a prediction. I think I suppose in the slides we have shown that it's further confirmed about that. I think that's a prediction about the mortality, or those we have 10 indices showing that. So I forgot which.
Okay.
But actually that's quite correct. It's not that difficult to make a prediction based on these 10 indices. So okay. I think that will be easier to get.
And that includes the lung infiltrates increasing rapidly to more than 50%. And the PO2F2 ratio, all of those, yes, okay, I understand.
Also, but one is very important is the lymphocyte. The lymphocyte is sometimes in some of the hospitals really a very important impact, showing the outcome. If it's less than 0.5, that would be poor users.
Well, that's a very helpful and simple marker. The steroid use, I think it was just under 50%, but was there any protocol, or, I mean, I would quite understand if steroids were given in the people with rapidly progressing infiltrates. What would be the guidance for any intensive care unit now who are starting to treat patients?
I think up to now, we have any compare studies looking at the corticosteroid administration. My impression is, so we usually do in those patients who develop very fast and deteriorate very fast, we use corticosteroid. Usually methylprednisone, right? And then you can usually 2 to 4 microgram per kilo. So perhaps in 3 to 7 days or something like that. So, but my impression is in some of the small cities, they use quite a long time, say like 2 weeks. But the majority of those patients who've been using corticosteroid too long will delay the shedding of the virus. It seems to be when they are on the corticosteroid, the situation is okay. When they withdraw it, it deteriorates very fast. So this is something I suppose it will delay the shedding of the virus.
Well, that's very helpful. Okay, thank you. I wanted to ask a few questions on logistics and how you managed to expand facilities. We saw lots of coverage of the new hospitals. I was interested at the other end of the spectrum, that how to increase medical care for people who are unwell but not very sick. And I believed you have used sports facilities, and how has that worked? We have something to learn from that.
Well, I suppose that's a method to separate the infected people and the not healthy people. That's the main reason. So because at that time, I mean, in Wuhan, that's just mixed. So it's actually totally lost of control, because quite a lot of number of the medical staff get infected. So that's a big problem. So at that time, that's also the infected people just stay at home. That's infect their family. So the first priority is to separate, to distinguish that from. So that's where those patients, huge patients, can go. So that's to just set up some simple hospital or ward to ask them to stay there. So to isolate the not healthy person. That's the main reason.
Okay. I was just trying to understand why they had to be there and not at home. Was it because they would just infect many more family members at home with big families?
Yeah, that's right. That's right.
Okay.
Definitely yes.
Okay. And I was just the impact on healthcare workers. It is obviously still, and even in other countries, of the 35 cases we have in the UK, we already have a number of doctors infected. Obviously, is a really major issue. How have you support? I mean, it's a team effort, obviously, and all doctors, medical people have a duty of care. How have you supported the healthcare workers? Are there particular tips you would give us in terms of psychological support and helping the teams? I know it's a difficult question, but it's something we all face.
I suppose that's a big problem in China. So in particular at the beginning. So altogether we'll have 1,700 of the medical staff being infected. Some of them died. So that's really at the first and the very beginning, basically in Wuhan. I think the main reason is two. I think two. One is they had lot of protective facilities, in particular eyes protection and the eye protection and the so-called Hoover, and then the protection clothes, and that's very important. And the second one is scare. So that's the medical staff at that time, at the beginning, they didn't know how to protect themselves from infection. So huge patient, huge medical staffs getting infected. So leading to the whole hospital in work at that time. So I think after having got enough provide of the protection clothes and eyes, so I think that the infection rate is really remarkably decreased. I think in the majority of the other hospitals in other cities, and there's a few medical staff getting infected.
Okay, and how did you cascade out that education to the healthcare staff? Did you send them videos? How did you improve the education?
Yes, some education. I think some teaching materials, but most important is because we have got the majority of the cities got some experience of outbreak SARS. They know how to protect themselves. I think the people, the majority of the medical staff, they know how to protect themselves. But at that time, we actually have no protection clothes. Really lack that kind of things. Okay. So I have a huge patient, including staff. So that's totally loss of control in Wuhan.
Yes. I was just talking to a colleague in North Italy, and even they have just over 1,000 patients, but they have some problems with the PPE equipment too, and it being in the right place. So wherever you are, it seems to be a problem.